तर आता तुमच्या मुखार फोक डान्स घेऊन येतले परतून एकदा TI NGO. Thank you, TI NGOs, for your wonderful performances. So, ह्या वर्साची थीम आसा लेट कम्युनिटीज लीड. सो कोंकणीन आमी म्हणटले जाल्यार चला समाजाक फुडारपण करू दी आनी हिंदीन समुदायांना नेतृत्व करू द्या. Now I request Shri Umakant Sawant, Joint Director IEC GSEX, to escort the dignitaries on the dais and also requesting him to take his seat. One kind word can change someone's entire day. So to bring more liveliness and enthusiasm in this program, I request Dr. Uttam Desai, CMO, State Family Welfare Bureau, to welcome the gathering with his kind words.
Good morning. सगळ्यांक माय मोगाचो येवकार. Today is World AIDS Day. On this day, people around the world unite to show support for the people living with HIV and to remember those who have died from AIDS-related illnesses. On this day, awareness-raising activities take place around the globe. Many people wear a red ribbon, the universal symbol of awareness of, support for and solidarity with people living with HIV. And to commemorate this occasion, we have with us Sri Arun Kumar Mishra sir, Health Secretary, Government of Goa, as Chief Guest. Sir, I welcome you on behalf of Goa AIDS Control Society. Also we have with us Dr. Geeta Kakodkar, Director, DHS, Dr. Rajendra Borkar, Medical Superintendent, South Goa District Hospital, Sri Umakant Sawan, Joint Director, IUC, GSEX, and esteemed audience, a warm welcome to you all. This year's theme is Let Communities Lead. The theme emphasizes the influence of communities on the HIV response and global health. The change depends not on moment but on a movement. The message Let Communities Lead not only ring out on one day, but it will be at core of activities that will build up across the year and beyond. The number of persons having availed the facility of HIV testing at ICTs, FICTCs, TPPs and community-based testing has climbed up from 22,917 in 2007 to 1,22,790 in 2023. The number of persons detected HIV positive have declined from 1,094 in 2007 to 219 in 2023, which is a true indicator of effective program implementation. The Antiretroviral Therapy Center GMC Bambolim provides treatment to PL-HIVs. Till October 23, 6,890 patients have been screened for ARV eligibility, out of which 4,675 persons enrolled for treatment and 2,538 patients are living with. ART Center at Hospicio Margao has screened 1,069 patients for ARV eligibility, out of which 1,010 patients enrolled for ARV treatment and 800 patients are alive on ARV. The state government provides financial assistance of Rs 2,000 per month to eligible PL-HIVs under the Anand Social Security Scheme, and till date 427 beneficiaries have availed the benefits. The government has also extended the benefit of 100% travel concession to the PL-HIVs residing in Goa for travelling on KTCL buses, and till date 1,884 PL-HIVs have availed the facility. Once again, I would like to welcome all dignitaries on the dais as well as off the dais and for this program. Thank you very much.
Thank you, sir. तर असे म्हणता की झाड लायल्याशिवाय कोणाकूच फळ मेळू शकना, म्हणजे ते झाड कोणी तरी लावचे पडटा. तशेंच आम्ही आयज हे गोवा स्टेट एड्स कंट्रोल सोसायटीच्या रूपान एक झाड पळयता ते खूप वर्सां पयलीं कोणीतरी लायिल्ले म्हणून म्हणजे तेजी कोणीतरी सुरवात केल्ली पूण त्यांच्या अधिकारी कर्मचाऱ्यांनी आपल्या मेहनतीच्या उत्साहाचे कार्य समर्पणाचे खतपणी घालून ते झाड व्हडले केल्ले आसा म्हणूनच आयज आमी त्यांच्या कार्याची फळां एड्स नियंत्रण हाडपाच्या ह्या क्षेत्रांत आमी पळयता. So I request Pragati Mishal to present a fruit basket to our chief guest, respected Health Secretary Shri Arun Kumar Mishra, IAS. I request Arati Malik to present a fruit basket to respected Director Dr. Geeta Kakodkar. I request Gauri Kanolkar to present fruit basket to guest speaker Dr. Rajendra Borkar. I request Gauri Gamas to present fruit basket to Dr. Uttam Desai, CMO, State Family Welfare Bureau. I request Pragati Mishal to present fruit basket to Shri Umakant Sawant, Joint Director, IEC, GSEC. Now I request the chief guest and other dignitaries to please light the traditional lamp. With the lighting of this lamp, may darkness be replaced by light, ignorance by knowledge, and sorrow by happiness. Youth Affairs, Shri Ramesh Rathod, Deputy Director TI, Ashwini Naik, Assistant Director BSD, to take over the charge of this prize distribution ceremony.
Very good morning. I request the prize winners to please come up on stage to take their prizes. I request the chief guest of the function to please hand over and award the prize to the prize winners. I request the fourth place winners, Dr. T.B. Kuna, Government High Secondary School, Kampal Panjim, Miss Siddhi Lotlikar and Miss Simran Kamat to please come forward on the stage along with their nodal teachers. Please be ready. Our third prize winners, Angle High Secondary, Marshall Loile. A big congratulations to you.
Photographer.
Our third place winners, Shri NES SS Angle High Secondary School, Marshall Loile, Miss Shayan Suraj Mirashi and Master Satvik Pagi. I request them to come along with their nodal teachers. Our second prize winners, MES, please be ready. Congratulations. I request our second place winners, MES High Secondary School, Zuari Nagar, Miss Soni Veeraj Mahatme and Master Akhil Cyrus Anand to please come up on stage along with their nodal teachers to receive the prize. And our first place winners, please be ready. A big round of applause for them. Our first place winners, DCT Vasantrao Dempo High Secondary School, Kujira, Miss Sneha Pundalik Bandodkar and Master Royston Gracias. Please come up on stage to take your award with your nodal teacher. A big congratulations, a round of applause please for them for our first place winners of our Red Ribbon Quiz Competition 2023. Thank you sir, thank you ma'am.
Thank you, Janice. Okay, मातशे प्रोग्रामान changes जाल्ले आसा. So I am very much delighted to invite our respected Health Secretary Shri Arun Kumar Mishra, who is a man of principle, symbol of honesty and perfect example of simplicity. Sir, काले बादलों को देखकर बारिश का बेसब्री से इंतजार जैसे मोर को रहता है, वैसे ही हमको भी आपके दो शब्द सुनने का इंतजार बेसब्री से है. So I request sir to please guide us in the prayer.
आदरणीय डायरेक्टर हेल्थ सर्विसेज मैडम गीता काकोदकर, डॉक्टर उत्तम देसाई, डॉक्टर बोरकर, जॉइंट डायरेक्टर साहब, आए हुए सारे स्कूलों के बच्चे, मीडिया, फ्रेंड्स, हमारे हेल्थ ऑफिशियल्स, हेल्थ पर्सनल्स, डॉक्टर्स जो भी अवेलेबल हैं. पहले तो मैं इस पूरी गोवा की टीम को इतनी बधाइयां देता हूं कि मैं पिछली बार भी 1 दिसंबर को आया था और ऐसे फंक्शन में इस लेवल का पार्टिसिपेशन होना बहुत अच्छी बात है, बहुत बड़ा इंडिकेशन है कि हम बड़े जागरूक हैं, हमारी सोसाइटी बड़ी इनलाइटेंड है. क्योंकि जब पहला गाना बज रहा था तो पीछे से चीयर्स भी आ रही थी. नॉर्मली ऐसे फॉर्मल फंक्शन में चीयर करना बड़ा डिफिकल्ट काम है, तालियां बजाना तो उससे भी कठिन काम है. तो ये गोवा की जागरूक सोसाइटी को मैं सलाम करता हूँ. पूरे देश को इस सोसाइटी को फॉलो करना चाहिए. मैं पूरे देश में चाहता हूँ कि इस तरह की जागरूकता है. आज जो वर्ल्ड एज डे मनाया जा रहा है उसका टॉपिक है लेट द कम्युनिटी लीड्स. और यही असली टॉपिक है, क्योंकि जहां स्टिग्माइज्ड डिजीजेज हैं, जहां भी किसी डिजीज को लेके कोई स्टिग्मा होता है सोसाइटी में पर से, फैमिली तो हर डिजीज को लेके परेशान होती है, लेकिन सोसाइटी स्टिग्माइज होती है ऐसे डिजीज से, उसके लिए भी सोसाइटी आगे आती है, सोसाइटी आगे आके लड़ती है. और उस लड़ने के लिए सबसे सिंपल प्रिंसिपल जो मैं फील करता हूं जो जीवन में, एक्सेप्टेंस. जो भी है एज इज वेयर इज बेसिस पे है. तो जब हम देखेंगे कि है कोई पेशेंट होता है तो उसको ये भय नहीं होगा कि सोसाइटी हमें स्टिग्माइज करेगी या कोई हमारे ऊपर कोई एक्सपर्सन कास्ट होगा, कुछ होगा, तो खुद ही आएंगे, ट्रीटमेंट करेंगे. बाकी बीमारियों की तरह ये भी बीमारी है और ये हमारे सिस्टम की, हमारी सोसाइटी की पर से इवोल्यूशन की प्रॉब्लम्स रही है, मॉडर्नाइजेशन की प्रॉब्लम रही है कि एक डिजीज जो एनिमल किंगडम में थी वो जम करके ह्यूमंस में आई. अभी मैं डॉक्टर साहब से बात कर रहा था तो ये हमारी जो पहला पेशेंट हुआ होगा अफ्रीका में, दूसरा होगा 80s के बीच में, 70s 80s के बीच में, उसका डोज कम रहा होगा, उसका एनिमल किंगडम से इंटरेक्शन और डेवलपमेंट के प्रेशर के कारण ऐसा हुआ होगा, वो स्प्रेड ओवर हुआ. लेकिन हमने 2 लेवल पे इसको डील किया. एक तो मिटिगेशन लेवल पे हम आए और दूसरा ट्रीटमेंट लेवल पे आए. तो मुझे बड़ी खुशी की बात यह है कि मैं डॉक्टर साहब लोगों से डिस्कस कर रहा था तो हम मिटिगेशन लेवल पे ही शुरुआती दौर में ही काफी कंट्रोल कर लेते हैं, जिससे कि एक्चुअल डेथ रेट या एक्चुअल जो थ्रेट होता था, जैसे पहले एड्स हुआ और खेल खत्म हो गया, मुक्ति का द्वार खुल गया कि आदमी ऊपर जाएगा. तो हमारी ट्रीटमेंट ने और हमारी सोसाइटी के रिस्पांस ने और पर्टिकुलरली गोवा की सोसाइटी के रिस्पांस ने इसमें वंडर्स किए हैं. जैसा कि आपने देखा कि 2007 से 22 डॉक्टर साहब जो फिगर दे रहे थे, डॉक्टर देसाई साहब, उसमें आपने देखा होगा टेस्ट बढ़ गए हैं, लैक्स प्लस टेस्ट चले गए और केसेस 2000 से नीचे आ गया, 1500 से नीचे आ गए, 200 आ गए. तो ये शो करता है कि हमारी सिंसियरिटी, हमारा कमिटमेंट और सोसाइटी की लीड इस डिजीज को खत्म करने में, अबॉलिश करने में बहुत महत्वपूर्ण योगदान देगी. और टेक्नोलॉजिकल इनोवेशंस हो ही रहे हैं और आगे होते रहेंगे और सारी डिजीज इस रूप में आ जाएगी कि ये भी एक कॉमन डिजीज है जिसके लिए आदमी को किसी ढंग की कोई परेशानी नहीं होगी। और एक बार फिर क्योंकि ये दिवस हम मना रहे हैं और पूरे उल्लास से मना रहे हैं, हम एक बार फिर एक अपने मन में शपथ लेंगे कि यही डिजीज नहीं, बाकी कोई भी डिजीज, बाकी कोई भी चीज जो हमें स्टिग्माइज करती हो। जैसे आपने देखा होगा कि गोवा सरकार में मैं विषयांतर कर रहा हूँ, आईवीएफ फैसिलिटी प्रोवाइड कराई। पूरे भारत में पहली बार आईवीएफ फैसिलिटी हमने प्रोवाइड कराई फ्री ऑफ कॉस्ट। आपको पता है कि जो फर्टिलिटी रेट है उसमें बड़ा गैप है। कुछ जगह फर्टिलिटी रेट हाई है, कुछ जगह गोवा जैसे में हम जो है मेंटेनेंस लेवल के नीचे जा रहे हैं, 1.3 के नीचे शायद जा रहे हैं हम। और ये स्टिग्माइज्ड है कि बहुत लोग प्रयास नहीं करते। तो ये भी एक एक्सेप्टेंस है कि यस ये है, तो इसके लिए एक ट्रीटमेंट है। और सब अपने बच्चों को मतलब बालपन का सुख लेना या मातृत्व या पितृत्व का सुख लेना, फादरहुड मदरहुड, द आवर बेसिक फंडामेंटल राइट। एंड गवर्नमेंट, द सोसाइटी, दे आर विद यू टू हेल्प यू आउट। इसी के बाद आप देखेंगे माननीय प्रधानमंत्री महोदय ने भी अभी रिसेंटली इस चीज को कहा था और पूरे देश में ये एक आंदोलन के रूप में वो भी फैलेगा। तो इसका जिक्र करने का मेरा अभिप्राय मात्र इतना है कि गोवा की जो हेल्थ सेवाएं हैं वो पूरे भारत में लीड है। लोग इससे एक प्रेरणा लेते हैं, आगे बढ़ते हैं। और इस बार मैं इस पे ये भी जोर दूंगा कि हमारी सोसाइटी की जो लीडिंग है, जो लीडरशिप कैपेबिलिटी हमारी सोसाइटी में है, वो भी पूरे भारत के लिए एक टास्क बेरर का बांध बने। हम इसे पब्लिश भी करना चाहेंगे, कैसे हमने सोसाइटी द्वारा लड़ा। और अपनी पूरी सोसाइटी को, गोवन सोसाइटी को मैं सल्यूट करता हूँ। और उन सभी लोगों को जो इस लड़ाई में हमारे साथ चल रहे हैं और आगे चलते रहेंगे, बहुत बहुत शुभकामनाएं देता हूँ। और आप सभी लोगों को यहाँ आने के लिए बहुत धन्यवाद। प्रोग्राम में थोड़ा हेर फेर इसलिए करना पड़ा कि मुझे फिर एक बार अभी तुरंत जाना है फिर, तो आप लोगों से क्षमा प्रार्थी भी हूँ कि थोड़ा प्रोग्राम में अल्टरेशन हुआ, उसके लिए आप जरूर क्षमा कर देंगे। बहुत बहुत धन्यवाद।
Thank you, sir, for your valuable presence and guidance. Thank you, sir. Now I request Shri Ramesh Rathod, Deputy Director TI, to take the charge of this felicitation ceremony.
गुड मॉर्निंग एव्हरीवन. कशे आसा? म्हाका दिसता बरे खुशी भोगता की तुमकां फोन हांगा की वर्ल्ड एड्स डे. वर्ल्ड एड्स डे इज ऑर्गनाइज्ड ऑब्जर्व्ड ऑन 1st December every year. That it is a day of solidarity for people around the world who are affected by HIV. This is a day for voice to unite the sharing the experiences, remembering those lost and standing together in the fight of HIV. NGOs are working with Goa State AIDS Control Society from 2000 till date. We have 15 targeted intervention projects across the state. Female sex worker, men having sex with men, transgender, injecting drug user, high-risk migrants and truckers projects to reduce the HIV epidemic through awareness, linkages, treatment, care support. So I request our guest of honor, Madam Dr. Geeta Madam, to felicitate our targeted intervention projects. They are working very tirelessly in these fields to provide the services, health services, clinical services and awareness also. So I request our TI NGOs, the first, the Lifeline Foundation Sakali, Mr. Ashfaq Sheikh. Mr. Narayan Nandiwale, Lifeline Foundation Sakali Projects. Nivas Patil, Migrant Project. Rishta Kalangut, Sophia, Mr. Dengil, Sunil Pednekar from Rista MSM project, Dinesh Patil from Mapsa project Rista, next Sai Lab Care FSW Miss Jinat Patan, साइलैब के ट्रकर शुभांगी गावड़े, एसएस महिला मंडल वास्को, हमसा ट्रस्ट एमएसएम प्रोजेक्ट वास्को मिस्टर लालबेग, मिस्टर मोनालिस ठाकुर हमसा ट्रस्ट मारगांव, महेश गोवेकर दर्पण आईडीयू, मिस्टर आजाद शेख दर्पण एमएसएम, प्रेजेंटेशन सोसाइटी मिस्टर सुनील कुमार कम्युनिटी रिसोर्स फाउंडेशन, Thank you. This is very tough job to identification of the high risk population and to provide the services. But our NGOs are working very tirelessly, even day and night also, if as per the community available. But I congratulate all the TI NGOs. They have scored more than 84% as per the 6-month grade. So next. I am happy. I have to give one round of applause to all the TI NGOs. Those are working with the AIDS Control Society and they provide the support to the AIDS Control Society. Next, one NGO is there. The Goa State AIDS Control Society supported for network. The Jindagi Goa. I request Muskan Sheikh, Saili Loriekar. It is a state level networks. They are providing services to the PLHIVs. Please. you, ma'am.
A warm welcome to all. I am representing 4 divisions of Goa State's AIDS Control Society. Basic Service Division and Care and Support Treatment Division are the 2 strong important pillars of NACP program. HIV counseling and testing services is a key entry point for prevention of HIV infection. Key role of BSA division is detection of infection among general, high-risk group and antenatal clients. To streamline the testing process, 12 SAICTCs, that is Integrated Counseling and Testing Centers, are located in various tertiary, district, sub-district and community health centers across Goa. Full-fledged counselor and lab technicians are placed at the centers to do pre-post counseling for HIV as well as to perform confirmatory tests. All the general as well as pregnant women along with the at-risk spouses are screened and tested at the centers. There are around 28 PHCs functioning as facility-led ICTCs and 15 TI NGOs closely working with SAICTCs towards the prevention and detection. Outreach work is also carried out by SAICTCs. Around 5,000 to 6,000 population patients are screened for HIV on monthly basis. Provision of counseling, linkages to TB and other comorbid referrals are done. Maintenance of the stock, documentation is some of the key functions of the center. EID testing, that is early infant diagnosis, is carried out in 4 centers where testing of babies whose born to positive mother is conducted at 6 weeks, 6 months, 12 months and 18 months. Born child is tracked for 1.5 years and efforts are being made with the proper medication to keep the baby negative. Our outreach partner Sati also plays a key role in tracking back the positive mothers and bring them back to the system. Out of 10 SAICTCs, 12 SAICTCs, 10 ICTCs have been awarded with the NABL MERIT certificate by National Accreditation Board for testing calibration and laboratories. It's my pleasure to acknowledge the work of ICTC centers to their dedicated service. May I request representatives or our SAICTCs to collect the token of appreciation. ICTC 1, Goa Medical College, Bambolim. ICTC TB and Chest Santine Spengium. Any representative from PHC Kandolim? ICTC PHC Kandolim. Our outreach partner Sathi organization, Mr. Vishant. STD Clinic, Goa Medical College, Bambolim. STD Clinic, North Goa District Hospital, Mapsa. STD Clinic, South Goa District Hospital, Margao. STD Clinic, South Goa District Hospital, Margao. Any representative from STD Clinic, Sub-District Hospital, Chikalim? Chikalim. Our microbiology department from GNC, SRL. ART Plus Center, Goa Medical College. ART Center, Hospicio Hospital, Margao. Link ART Center, North Goa District Hospital, Mapsa. Any representative, Link ART Center, North Goa District Hospital, Mapsa. Link ART Center, Sub-District Hospital, Chikalim. Link ART Center, Sub-District Hospital, Ponda. Thank you so much.
Thank you and congratulations to all. So now I request our distinguished guest of honor, Dr. Geeta Kakodkar, Director of Health Services, to address the gathering and to give her precious input.
Secretary Health was our chief guest today. He had to leave because of other commitments. Still, I acknowledge that in spite of numerous responsibilities, he was here today and showed his commitment to the cause of AIDS, HIV/AIDS, its screening, diagnosis, treatment, all that. He showed his commitment to the same. Dignitaries on the days, my staff from GSACs, staff from DHS, NGOs. It was very heartening to see you are participating. You participate actively in the field. Now it was very heartening to see you all actively participating on the stage also, and all the other people present here, the media. Today we are celebrating World AIDS Day, in which we spread awareness of AIDS. We also acknowledge the problems people with HIV may be having now. Even though the stigma has far reduced, it still exists, and that prevents people coming forward for testing. If we need zero new infection, the most important thing is testing. And we have commitment from several quarters, from the medical side, in the field, the NGOs are working so hard. awareness is created in the schools, so many other activities, and I applaud GSACs for continuing with these activities, the NGOs for their commitment in the field, and all the Red Ribbon Clubs, the members of the Red Ribbon Club for spreading awareness. As far as HIV is concerned, we know that the theme this year, let the community lead. For any kind of program, we have seen that unless there is community awareness, support from the community, support from the local leaders in the community, we cannot take any program forward. HIV has been there for a very long time, and as Dr. Uttam Desai has said, the incidence has fallen, we have better ways of diagnosis, treatment, we have support from all sides, and we have a multi-pronged approach to see that we do not get new infections. But still, I feel that in the schools and in the children, many of the school children are here today. What happens is when you are very young, there are a lot of things, especially in social media and other places. There are right things also. There are many wrong things also. So you should be have discretion on seeing what are the good things and what are the bad things. For new infections, what I really feel is that you should stay away from alcohol, drugs, substance abuse, which lowers your guard. And you should not go for peer pressures or anything, and do not experiment in these things, because once your guard is down, you are young, and it leads to some sort of risk-taking behavior, which will have long effects on your life. So I exhort all the students here to take the commitment to say no to drugs or alcohol, and see that you lead a very good life. Also today, like I said, the NGO's commitment, I have been a part of though for a very short time, in GSACs. I have seen how hard the NGOs are working in the high-risk communities to see that this spread is stopped. If you are aware of your HIV status, then it is easy for any person to take precautions and see that the infection does not go to others. So we still have to continue with the awareness, and we should still not stigmatize people. By now, when HIV was first there was a lot of misconceptions, fears, people were isolated. But now we know a lot about HIV, how it spreads, how it does not spread. But still, we need to create awareness in every pocket of our state. Our state is small, like we have very good health indicators, we are high in in whatever services we are giving to the people health-wise, we are giving a lot of services. So we have to see that our commitment towards HIV does not waver. So once again, I wish GSACs, I wish all the NGOs, all the students, all the people gathered here, the very best, and hope that this war against HIV comes to a point that where we have no new infections. Thank you very much.
Thank you, madam. So the theme for this year is Let Communities Lead. To get more knowledge about this, I would like to request Dr. Rajendra Borkar, MS of South Goa District Hospital, Margaon, to enlighten us on the topic and theme.
Hello. So, good morning. I'm Dr. Borkar. In the very beginning, let me tell you that for quite a long, I'm not involved into active AIDS control program. But nevertheless, I have worked as health officer, as medical officer in HIV AIDS. And I'm extremely thankful to our director, Dr. Geeta Kakodkar, and my colleague, my friend, Dr. Uttam Desai, for inviting me here as guest speaker on the subject. And this year's theme, as you all know, is Let the Communities Lead. And I have only a few slides. I promise you right in the beginning that I will not bore you with my presentation. So first of all, let me tell you that when we talk about the communities leading, we have three words that we have to understand. That as a commitment, we are supposed to invest in the communities, we are supposed to innovate, and we are supposed to integrate. Because what they say is that if the communities are empowered and if the communities are successful, the country is successful. We all know that by 2030, we are supposed to, we aspire, we dream to end HIV/AIDS by 2030. And before that, we had a policy which said 0 new cases, 0 deaths, and 0 discrimination. I'm happy to tell you that India as a whole has achieved quite a lot in terms of 0 new cases, because the cases are reducing day by day. Deaths are also reducing day by day, so we are doing a good progress in these two fronts. But discrimination part, as everybody is saying, including a director has said, that discrimination part is still remaining. And that is why this time the theme is let the communities lead. Because that discrimination basically is coming from the communities. What we have achieved as on today, 2023, we have again 3 targets which were given in 2014 by WHO, is that we should have a figure of 95 by 95 by 95. That was, out of the total estimated cases in India, we should be able to diagnose, we should be able to identify at least 95% of the cases. Of those cases identified, we should be able to treat at least 95% of the cases. And of those who are treated, we should be able to control the retrovirus multiplication at least in 95%. That target we haven't been able to achieve as yet. We have achieved it as to 86% of identification, 89% of treatment availability, and 93% of conversion. So this is where we actually stand. With this brief introduction, so to say, let me briefly go through the slides, because what I found is that since I am presenting the last, most of what I am going to say now has already been told by my colleague Dr. Uttam, my director Dr. Geeta Kakodkar, and of course the health secretary. So let me briefly tell you some highlights as to what we have achieved and what we are to achieve. I'll first present the global scenario, then I'll talk about what is in India, and then I'll tell you what is that in Goa. Right? So next, so the theme is let the communities lead. Next, I hope everybody is able to see. So it is celebrated on 1st December every year. Next. So we are committing towards the government policies and empowering the communities. Next. The theme is let the communities live, because the change depends not on the moment, as Dr. Uttam has said, but it depends on a movement. Moment is today what we say, but the movement is throughout the year what we do. This is the scenario globally, that 58% of the total cases, and mind you, whatever I am talking about is as of 2021, but hasn't changed much. 58% cases are in sub-Saharan African countries, 58%, nearby 60%. About 430 among children under 15 years of age, and about 3,600 are among the adults aged 15 years and older, of whom almost 49% are among the women. So I only want to highlight that most of the cases are in the African continent, and overall globally most of the cases are among the women. Next.